Hi, this is Dr. Dumestri. I'm a board certified plastic surgeon, and I'm going to continue on my next mini series regarding what do you do with old implants. So, implant removal versus implant exchange, with the reasons why people may seek implant removal or implant exchange in the first place. So these could be because the patients are actually having issues related to their implants. So that could be something like breast implant illness, like I discussed on my last video, capsular contracture, or a thickening of the natural scar envelope that surrounds the implant. This can produce either subtle changes that aren't visible or can actually squeeze the implant, slowly moving its position out of place on the chest wall, and can also cause pain. There can be pain unrelated to capsular contracture, implant ruptures. There's a little hole in the implant shell. Or sometimes it's just patient factors. So I've had patients tell me they're done with them. They enjoyed their implants while they lasted. They don't want to have those there anymore. Some people just really say they want to belly sleep without the feeling of any implant there. When they hug people, they want them gone. So some patients are just done with them. It could be changes that are natural that occur in either the implant or the breast envelope, and I'm referring specifically to droop. So you can either have drooping of your breast gland and nipple over the implant, so the implant stays in position, but then your breast kind of falls off of it. So when you look on a side view, it kind of looks like a long, flat type breast. That's known as waterfalling, where the breast gland is falling off of the implant that's still perky. Or you can have implant droop, where the implant itself shifts down and then can either sometimes just look like the breasts are sitting too far down on the chest wall, or can actually create a sort of crease that's referred to as a double bubble. Or it can also be a desire to avoid future surgery. So say someone's had their implants for a long time and they say, listen, I just don't want to have any surgeries in my future that I know I have to do. I feel okay not having these implants, so I'm just going to take them out now while I'm healthy, while I have no medical problems, and then just get on with things. Those are some of the most common reasons that people come to me for implant removal or implant exchange. Stay tuned for more in my mini series.